This is Late Night Health. This is the radio program that cares about the most important part of your life, and that's your health. I'm Mark Alyn, and during the next 2 hours, we're going to share some information, some education, some thoughts on your health. Wide variety today. I mean, we are all across the board. During the second hour of our show, we're actually going to be talking about dental health and snoring and tooth grinding and how that can affect all kinds of other parts of your body with Dr. Robert Pine. We'll also be spending some time with the nutrition director at the Canyon Ranch in Tucson, Arizona, talking about gluten-free diets. We're going to talk about pancreatic cancer, and we're going to start our program today talking with Dr. Leonard-Friedland. He's the Vice President, Head of Scientific Affairs and Public Health, Vaccine Division of North America for GSK. GlaxoSmithKline is what it used to be known as, right?
That's right.
That's right. And we're going to be talking about flu. I am torn, Doctor. I'm going to be really honest with you. We're going to talk about flu vaccines and how to prevent flu, how not to get it, and if you get it, how to feel better while you're suffering through it. The flu can be devastating. It can be life-threatening, and I think everybody appreciates that. But let's talk about the controversy, if you will, first of all, about vaccines. I personally am torn. Every year, up until this year, I've had a flu vaccine. And the reason I didn't get one this year is because my wife forgot to tell me when the flu clinic was, okay? And so I didn't show up. But I showed up last year, and I had some questions, and I'm going to ask you those questions. On the packaging that the nurse was unpacking as she was getting ready to give me a shot, it said, not clinically proven to prevent the flu. So I'm curious about that. I understand there are 1,000 different strains of flu, and as we've just talked, there are probably another 1,000. Can you explain that to us?
Well, sure, Mark. And first, to mention, there's still time for you to get your vaccination, and I encourage you and all of the audience to speak to the healthcare providers or the pharmacists about flu vaccination. Flu season is just now starting, and there's plenty of time to get vaccinated. Of course, the best time is before one comes down with the flu and is exposed, so now is really the good time. So there's still time for you. Now, getting to your question, no vaccine is promoted to be 100% effective. Yet the flu vaccines have been clinically proven, to use those words, to prevent influenza. They're just not 100% effective. No vaccine is 100% protective.
But nothing is 100%. We're human.
That's right.
We're human.
That's right. So perhaps that's what that's about. We do know that influenza vaccines work, and they work well to protect not only the patient but also the community and the loved ones that people are around. Every year in the United States, hundreds of thousands of people miss work and miss school due to influenza. Tens of thousands of people are hospitalized from influenza, and in some years up to 40,000 Americans can die from influenza. And influenza is an infection and a disease that can strike people who are healthy as well as those who have underlying medical conditions. So nobody is immune from the effects of influenza, and the best prevention is to be vaccinated against this illness, which can be really quite severe.
It can be, and as you said, people do die from it. I've talked to a variety of doctors, MDs, NDs, DCs, and I get all kinds of comments. Several of the doctors, MDs that I've talked to, don't recommend it. I've asked why, and I don't get an answer. They just don't think it's necessary. I've talked to naturopaths, and they're saying that, if we're exposed to it and we come down with it, it does help build our immune system. Isn't that basically what the flu vaccine does? Helps to build the immune system against this virus?
All vaccines help to develop the immune system to fight off disease. we do know from influenza, because the virus changes routinely and very quickly, that immunity to infection, be it from natural infection, which would mean getting the disease, or from immunity from the vaccine, it doesn't last more than one season because the virus is constantly changing. And so natural immunity will not protect somebody from getting influenza in subsequent seasons.
But if I take the flu shot, I won't get it next year? The chances are greater that I won't get it next year?
No. Each year we need to have a new influenza vaccination because the viruses that are circulating are changing, and so the composition of the vaccine changes from year to year. If you're interested a little bit, just a sidebar on how this works and how vaccines are selected. Because influenza is a virus that is constantly changing, and there are 4 common types of influenza viruses that cause disease in humans. They're called 2A's and 2B strains, and we can come to those 4 strains in a moment because now there are these new innovative 4-strain vaccines, which we have developed 2 from GlaxoSmithKline. But the important thing to mention about these strains of viruses is that because they're constantly changing, the World Health Organization, the Centers for Disease Control, and similar centers in other parts of the world, in Europe and in Asia, for example, and in Latin America, are constantly looking and collecting samples from people who are coming down with influenza. And as these samples are collected, they're sent to reference laboratories, and we're constantly looking to see what are the viruses that are circulating around the world. Each year, in February, the World Health Organization meets, and then subsequently in the United States, the Food and Drug Administration meets, to review this information that's been collected in these so-called sentinel laboratories all over the world.
And that's for the following year, isn't it?
That's right. And so then we look to see what's been circulating recently, and then they say, you know what? Our best science suggests that we should make next year's vaccine cover these type of strains which are circulating right now, try to get ahead of it.
From GSK, the Vice President, Head of Scientific Affairs and Public Health, Dr. Leonard-Friedland, he's an MD. You've done all kinds of medical work in your career, and you're now with GlaxoSmithKline. I am not against vaccinations. I think that they've saved millions of lives. I mean, there's smallpox, there's polio, it goes on and on and on. There's all kinds of vaccines. The newest one out is for shingles. If you're over 60 or 65. Are you guys still there?
Yes, I'm here.
Okay, good. So vaccinations make sense to me. They really do. I'm concerned about a couple of things. I mean, if I'm allergic to eggs, you're not supposed to take it. If you have a cold, last year the nurse said to me, do you have a cold, Mark? And I said, no, I don't have a cold, and I got jabbed. They asked me about being allergic to eggs. I am allergic to mercury. Everybody is. This is another question that people ask about. And I know that there are some vaccines without the mercury element. Can you explain to me? I know it's part of it is a preservative. Why are you using mercury? I used to play with it in chemistry class. Now they don't let kids touch it at all.
Right. I'll come to that in a moment. First, I'd like to mention that every year influenza vaccines are given to people all around the world very safely and effectively. In the United States, hundreds of millions of doses of influenza vaccine have been given to the United States public safely and effectively to help protect our public and protect individual patients against an illness that can be really quite severe and can even result, unfortunately, in death even to healthy people. Every year, unfortunately, even healthy children die from influenza. Your question is about the preservative called thimerosal. Some influenza vaccines are distributed in what we call multi-dose vials. So there's 10 doses of vaccine in a vial. And these types of multi-dose vials are very useful for centers that are taking care of a lot of patients, and they can get many doses of a vaccine out of one vial. It's easier to store, takes up less room.
They change the needles, though.
Of course, absolutely.
Yeah.
absolutely the needles are changed. So these are multi-dose vials, and they're very popular in certain circumstances.
Okay.
Because the vials are used multiple times and sterile needles are going into the vial to pull out doses, the vials have to have a preservative. The only licensed preservative anywhere in the world is thimerosal for use in vaccines. Thimerosal is safe and is judged to be a proper preservative for these multi-dose vials. Single-dose presentations, be it in a vial or in a syringe, do not have a preservative, and therefore they do not have the thimerosal.
And
These are options for public health, and various public health officials choose to use vaccines in their own way. The most important thing is that the public health officials, the healthcare providers, doctors, nurses, the pharmacists,
when we come back, we're going to take a timeout. When we come back, we're going to find out other ways to prevent the flu, or at least to alleviate some of the symptoms. Our guest from GSK North America, Dr. Leonard Friedlander. Coming up in the next half hour, Otto Jenke will be joining us, the author of You Were Born to Be Healthy. I'm Mark Alyn. You are tuned to Late Night Health. We'll be back. Don't you dare go away.